A joint is where two bones come together and meet. And I'm sure you guys have heard of being double jointed. But what exactly does that mean? Does that mean somebody has two joints where everyone else has one? I'm sure you've seen, some of the more simple double jointed tricks where someone can push their thumb back or twist it behind their hand, or maybe even the crinkly fingers. Abnormality are, a lot of people can do this, but these are, kind of fall within the realm of stupid human tricks. But there are some people who have such amazing flexibility of their joints that they can do really crazy contortions. I think a great skill that I would really like to be able to do is this one. Perhaps on the day we talk about joints, being able to stick your head between your legs while standing upright might be quite the achievement. But really, double jointed does not mean anyone has more joints or less joints. We all pretty much have the same number of joints in the same places, but those who are quote unquote double jointed, their joints just have more stretchy and flexible supporting structures there. So the ligaments are more stretchy, the capsule and the maybe the synovial cartilage and other things there are just stretchier than normal. So there's a spectrum for those things, and if you have really stretchy joints, you can contort your body in much more ways. Joints are, in fact, however, the weakest part of the skeleton. It's the part where you no longer have that bony matrix. You have connective tissue, and so it also can be taken advantage of as places where, in self-defense, you might twist or pull or use to get somebody away from you. There are two functions of joints, mobility and cohesion, really being able to move and keeping your bones all connected. There are a number of bones which come together in the hip joint. If you count the 3 fused bones in the hip and then the femur, that would be four bones in that joint. Whereas the shoulder, if you counted the humerus and then the pectoral girdle, clavicle, and scapula, that would be 3 bones there. Arthrology then is the study of joints, and orthopedics then is the branch of medicine that deals with joints combined with bones and muscles and their functioning correctly. We can classify joints in a number of ways. First structurally, they can either be made of fibrous, dense connective tissue, regular or irregular. They can be cartilaginous, such as hyaline or fibrocartilage, and they can be synovial, which is a specific type of tissue, which creates a synovial membrane, which creates synovial fluid and creates this synovial capsule. Or we can classify them functionally. A synarthrotic joint has no movement, an amphiarthrotic joint has slight movement, and a diarthrotic joint has free movement. So here are some examples of each. A fibrous joint includes sutures, which are where 2 flat bones come together, such as in the skull. A gomphosis is where you have this ligament, the periodontal ligament, and a socket, which is characteristic of your teeth sitting in the bones. And the third one is a syndesmosis, which is what you see at the distal end of the tibia and the fibula. So at that joint you have ligaments tightly winding those two together. The length of the ligament then determines the mobility of that joint. You then also have cartilaginous joints. You can have a symphysis, such as the pubic symphysis, where fibrocartilage is sandwiched between hyaline cartilage. Or you can also have a synchondrosis, which is strictly hyaline cartilage, which occurs in the epiphyseal plate, or the epiphyseal line, the growth plate between the epiphysis and diaphysis of a long bone. The third then type of structural joint is the synovial joint, and there are a number of different types of synovial joints, as you can see in this figure. A plain joint includes carpals and tarsals, which is basically where you have all these joints together and they're kind of squishing together. A hinge, such as the elbow and knee, so there's some a range of motion allowed there. A pivot, where you can rotate. A condyloid, where you can see there's kind of like a ball and then a covering for that ball there. That happens between the radius and carpal bones of the wrist. A saddle, so here's a saddle joint here, kind of saddle shaped where it dips into the other one. And then a ball and socket, which would be like your humerus in your shoulder or your femur in your hip. Functional joints, so their movement includes our synarthrotic, which we don't want these to move. We move very little. Include those sutures in the skull, the gumphosis, the teeth sockets, and the synchondrosis, which would be the epiphyseal plate or epiphyseal line. We also have amphiarthrotic. You want slight movement here to allow some movement, but not a lot, including the syndesmosis between the tibia and the fibula, and the symphysis between the pubic bones. And between your vertebrae, you have some movement which is allowed by through the squishing, essentially, of those cartilage. And diarthrotic, which is free movement. All synovial joints are diarthrotic. They allow for more free movement there. All right, so the synovial joint is of specific interest because of the structures there, which are important for the functioning of these joints, which allow us to move. There is a section there where you have articular cartilage, where the two bones kind of are facing each other. The joint cavity, which is filled with synovial fluid and is lined by synovial membrane. The articular capsule then is made of a fibrous layer made of dense irregular connective tissue and that synovial membrane to secrete the fluid. The synovial fluid then is made up of a fluid which reduces friction, essentially a lubricant between the two areas, so these bones and this cartilage doesn't grind against each other. It allows for compression, and also there is no actual blood supply going into this synovial area. It is transferred from the blood through the synovial membrane and then into the synovial fluid. So it is a source of nourishment, and it has immune function, including some white blood cells floating around in there. The fifth part is the reinforcing ligaments, which then would be around the articular capsule, and nerves and blood vessels, which are innervating the synovial membrane. There are other accessory structures of synovial joints which aren't found on all of them, but are found in some of them, including fatty pads. You can see that in the knee here. Here's a nice fatty pad there. And articular discs, which would include the meniscus found in the knee. You can see these are menisces here, which are made of fibrocartilage, which helps just add another layer of cushion protection between all the bones in that joint. There are also bursae, which are like ball bearings. Essentially, it's a little fibrous sac contained with synovial membrane and synovial fluid, and a tendon sheath, which is a bursae surrounding a tendon, kind of like a hot dog bun, and then the tendon would be the hot dog. All right, so now that we know about joints, as we know, help us move in many different directions and ways, and we classify these joints the joint movements by what they do. Essentially, these are dance moves. Some of them are angular, where you have one axis crossed, such as in the elbow and knee, shoulder and hip. And so we'll go over these. The first of which is abduction and adduction. So abduction means abduction means being pulled away from the body, so you can see that here. And adduction means being pulled towards the body. So this is abduction and adduction. So raising the arm would be abduction, lowering the arm would be adduction. You can do the same thing with your leg. Flexion, extension, and hyperextension. So this is decreasing the angle between two bones. When you flex your biceps, you're flexing the or decreasing the angle between your forearm and your arm. You can then extend it away, and hyperextend it means to go even further than 180 degrees. You can do the same thing to your knee. However, hyperextension to some extent is not good. It can damage the joint. So here we have abduction of the legs here in the extreme form of a split, adduction of the arms here as this gymnast is twirling through the air. Go Canada. All right, we have rotation where we pivot over one axis. So this is like moving your head from left to right. Circumduction is where the proximal end stays put and the distal end rotates away. So that would be like, rotates in a circle. So this is circumduction here. If your arm makes like a circular motion, it's kind of involving multiple planes there. Our fourth group are special. They don't really fall into any category. So special types of synovial joint moving. We have elevation and depression, which occurs with the mandible when you open and close your mouth, and the shoulder when you shrug or slump your shoulders. You can also move your jaw forward and backwards, and this would be called protraction and retraction. Inversion and eversion, which is turning towards the midline and away from the midline. Inversion would be towards the midline, eversion would be away. When you kick a football or kick a soccer ball, you move from everted to inverted as you do so. That is, if you do it correctly, I guess. Pronation and supination would then be turning your palm up to palm down. You can do that with your forearms, how you twirl baton or a wicked bow staff. And what you're essentially doing is crossing the radius and ulna from being parallel to crossed. Dorsiflexion and plantar flexion, you do this with your foot. Dorsiflexion is pointing your toe up, and plantar flexion is pointing it away. You also do this when you kick a soccer ball. And then opposition, which is using your finger and your thumb in opposing circular motions. So again, if you can put all these together, you can come up with a wicked group of dance moves. I really like the adjective wicked for this joint lecture. Michael Jackson here is then participating in some plantar flexion with his feet. His arms are adducted towards the body, and you see some flexion here in the legs, and of course moonwalking is then Oh, he even has a little bit of opposition here with his thumb. Moonwalking is then rotating between dorsiflexion and plantar flexion as you move backwards. And maybe we'll get an example of that in class as well. All right, there's a couple of very important joints we're going to cover. The shoulder joint is very complicated. There are 4 ligaments and 5 tendons which hold this arm to the shoulder. In the superior plane, you have the coracohumeral ligament there, which is a very important attachment. And the superstabilizer is the biceps tendon. In the anterior, you have the glenohumeral ligament. And then in the posterior, you have the rotator cuff tendons and muscles all attaching. So very complicated group of ligaments, muscles. You have bursae, articular capsules, everything here involved in keeping rotation there seamless. The hip joint has 20 ligaments and tendons, corkscrewing with the femur and the coxal bone to create that attachment. We're not going to go through all of those, but do know it's a very complicated and important joint in the body. And the last one we'll go over is the knee joint, which is actually 3 joints in one. The femoropatellar joint, so between the femur and the patella. The tibiofemoral joint, which has a lateral and medial joint. And this is a site of many injuries. So the knee is a site of a lot of sports injuries, especially if you get kicked from the side, and it can cause tears in these ligaments. Another joint problem that you may encounter includes luxation, which is essentially dislocation, where the socket and the head of the humerus or the femur comes out. It can also occur with fingers and the jaw, and the bones need to then be put or placed back into place, which is called being reduced. Arthritis, there are 2 forms, osteoarthritis and rheumatoid arthritis. Osteoarthritis is due to a reduction in cartilage, which eventually causes these bones to rub against each other and inflame and distort the joints. And rheumatoid arthritis is an autoimmune disease where their immune system causes inflammation in the joints and destruction and pain, and similar in symptoms but different causes. And finally, a torn meniscus, another common knee injury, where the meniscus, those circular or C-shaped pads, become compressed and ripped or torn. Generally, a procedure will go into the knee and then scrape away that damaged part, because they generally don't heal very well because there isn't a good blood supply. All right, and that's it for our joints.